Hello, good evening, everyone. Welcome to EDEN 2, the Master Revision Series. Today, we will be dealing with the second round of anatomy questions. So, are you all excited? I am very much. Today, we will be announcing the winners of our first edition, that is, the contest what we conducted, the results of that will be announcing. Similarly, there will be a contest today also where 5 MCQs will be given and a phone number will be given. You will have to answer it, and the person who answers first and with maximum correct answers will get a wonderful book of EDEN 2, a notes of EDEN 2, which includes anatomy, physiology, biochemistry, DADH, which has a beautiful flowcharts, well crafted notes, and very easy to remember with lot of mnemonics as such. So dear students, today we are in our second round. So to make it more exciting, what I have done is, along with our short essays, short answers, one big main question towards the end I will be discussing. And not only that, in between each topic, lot of mnemonics, which are viva questions, which are difficult to answer, those things also I will be discussing. So I hope you're all excited. So let's start. Okay. So before we start, let me tell you the contents what we are going to talk today. So first and foremost, we'll start with easy questions and then we'll increase the difficulty level. So first, we'll start with suspensory ligament of Lockwood, which is a short answer in any university. Then Waldeyer's lymphatic ring, very, very important question. Third question is structure passing between pharyngeal muscles, that is superior constrictor, middle constrictor, inferior constrictor. What are the structure passing through them? It's very confusing. So I'll give you a mnemonic for that. With that mnemonic, we can easily decode and write the answer. So that will be the third question of the day. Followed by nerve supply of parotid gland. So there is a flow chart. How to remember that flow chart? What is sympathetic? What is parasympathetic? All the concepts will be clear today. What do you mean by sympathetic and parasympathetic? I teach you in such a way that you will not forget for the rest of your life. After that, we'll be discussing facial nerve, the branches. In our previous section, we have discussed about the intracranial cores. And once it comes from stylomastid foramen, what are the branches? What are the intracranial branches? What are extracranial branches? We'll be discussing. Then nerve supply of scalp, the first chapter what you study. But there's a beautiful mnemonic with which you can answer in seconds. Then a tougher one, Pterygopalatine ganglion or spinopalatine ganglion, whatever you call it, both are same names. That we will be discussing. Then facial muscles. How to remember the facial muscles? Some 18 or 20 facial muscles are there in our face. How to remember them in order with the mnemonic? I'll be discussing them. Then, if towards the end, I'll be discussing a big main question, temporomandibular joint. This is a question which comes in any university. Almost every 2 to 3 exams, it repeats. I'm not telling 2 years, 2 to 3 exams. So in a year, you'll have a regular exam, a supplementary exam, and next year, again a regular. So in 3 exams, one question will be there from temporomandibular joint. It's the joint which a dentist must know in and out. So guys, are you all excited? Please put it in the chat box. Yes, no. Can we begin? Yes. Thank you. Thank you for your feedback. So let's start now our first question of the day. That is suspensory ligament of Lockwood. Now, the name itself tells suspensory. What do you mean by suspensory? Suspensory means which is moving, suspending. Ligament. Ligament, in the diagrams, in any textbook you see, the ligaments will be in green color. Right? It will be in green color. Now, ligament is bone to bone attachment. One mnemonic I will give you. Before I start this, one beautiful mnemonic. Take out your notebooks and write in capital letters. 3 letters I will be telling you. Write that. M, T, B. M for Malaysia, okay? T, Tata Nagar. B, Bangalore. M, T, B. Now, the middle letter is T. The middle letter is T or Tata Nagar T. So, T stands for tendon. T stands for tendon. Tendon is a connector between M and B. Muscle to bone contact is done by tendon. So I hope it's very clear. The next mnemonic, just write BLB. B for Bangalore again. BL, ligament. L, B, Bangalore. BLB. So bone to bone contact or the adherence between two bones is done by ligament. So this is the suspensory ligament of Lockwood. So it's a bone to bone contact. So let's go in detail. So from where this question is picked, it is from your eye chapter, ocular muscles chapter. So before I go into the details of this question, it is a short answer. It's a very simple question. It's a short answer. So you should be able to answer this question within 5 minutes with 1 or 2 diagrams, 5 to 7 minutes. It comes under short answer category. Right. So now look at this diagram. You have this pink color, that is the eyeball, right? Next to the eyeball, you see here, there is a protective covering, which is in green color. This is a sheet of optic nerve. And then you see this green color, extensions are there, 2 wing color. One is this side, another one is this side. 2 extensions are there, which is towards the medial side. Medial. So if you look at me, my central part is this nose, which is towards my medial side. So this is the medial side. So this part, medial side means which all bones are here in the medial? Lacrimal bone. Lacrimal bone will be here. Lacrimal sac we have here, right? So lacrimal gland we have here. Lacrimal sac is in the center. So here lacrimal bone is there. So that is towards the medial side. So this green color extension, like the curtain what you are seeing, is called as medial check ligament. MCL, medial check ligament. And on the other side, what you see, which is on the other side, that is called lateral check ligament. So lateral check ligament, other side, what is this bone here? This is called zygomatic bone. So this yellow color structure, what you are seeing is zygomatic bone. So this is an eye. We have a protective covering called optic sheet. On the medial side, medial check ligament is connected to lacrimal bone. And on the other side, lateral check ligament is connected to the zygomatic bone. I hope it's very clear till here. So this diagram, we will change the direction now. So once you change the direction, the diagram will look something like this. We're just seeing from the other side, right? So this is the diagram which will be there in your textbooks also. I'll be coming here. Now let us discuss the same diagram what we have learned about right now. Medial check ligament, lateral check ligament. So here the green protective covering, I told you that is called sheet. So in this sheet, a lot of extraocular muscles will be there. That is your rectus muscle, 4 recti muscle, 2 oblique muscle, levator palpebrae, superiorus muscles. All of them will be there in the sheet. Along with that, ciliary vessels will be there. Where in the sheet protective covering. Then I told you the sheet gives number of extension, 2 extensions. One on the medial aspect, one on the lateral aspect. Medial aspect is connected to lacrimal bone. So that is called medial check ligament. And it is connected to lacrimal bone. You can see here where my cursor is moving. Other things you can read it from textbook. I'm just trying to help you to understand this. So similarly, lateral check ligament is on your lateral side and it is connected to the zygomatic bone, right? It is connected to zygomatic bone and lateral rectus muscle will be here on the lateral aspect, medial rectus muscle on the medial aspect. So it's very clear. The name itself is telling medial, lateral. Right. So this is the diagram what you should know. If you know this diagram, you are done with the suspensory ligament of Lockwood. Now you would have seen people in beaches, especially in Goa and all, where you see a lot of foreigners. So in a beach, they will put two poles, and with a net, they will make one suspensory, what you say, net will be there where people will lie down and they can swing also. Similarly, this is your eye. Below the eye, you see that there is a big swing here. Swing. It's a big swing here. So this is, your nose will be here. Okay, this is the medial check ligament, means your nose will be here where my cursor is there. So we are talking about the right eye. So on medial aspect, you have got medial check ligament, and this is medial rectus muscle. Muscles are brown in color. Green color one is ligament. Then on the lateral aspect, you have lateral check ligament and lateral rectus muscle. So brown one is muscle, green one is ligament. So from the medial check ligament to lateral check ligament, you see a U shape, one swing goes up. Here it is very narrow. Here it is very narrow. Slowly once it is coming in front, you see down here, it becomes completely, it becomes what? Completely bigger. It becomes completely bigger. And then what happens? Here, inferior rectus muscle is there, inferior oblique muscle is there. So this is what we have to study. This is the question what was asked, suspensory ligament of Lockwood. So what is suspensory ligament of Lockwood? Draw this diagram. Then from medial check ligament to lateral check ligament, there is an extension. That extension is called suspensory ligament of Lockwood. What are the contents here? Contents are medial rectus muscle, 1, medial check ligament 2, inferior rectus muscle 3, inferior oblique muscle 4, lateral check ligament 5, lateral rectus muscle 6. 6 contents are there. They all form together suspensory ligament of Lockwood. Very simple. I hope now you are very clear with it. So, 2 check ligaments, medial check ligament, lateral check ligament. Medial rectus muscle, lateral rectus muscle. Inferior rectus muscle, inferior oblique muscle. So 2 inferior muscles, 2 check ligament, and 2 medial rectus muscles. 6 components are there. Learn this diagram. Okay. So the lower part of the Tenon's capsule, this is the theory part which you have already understood. The lower part is thickened and it is known as suspensory ligament of Lockwood. In the center part, it is very thick, where your inferior oblique muscle and inferior rectus muscle is there. Inferior rectus muscle, inferior oblique muscles are there. And on the sides, medial check and lateral check ligament, it is like a swing. So that is the question what they have asked. So our first short answer is over. Now, dear students, during the course of our session today, I will be announcing the winner also, right? So the winner has done extremely well. So any one of you can be the winner. Any one of you who have answered correctly can be the winner, right? So I hope the winner is watching us live today. And once it is announced, please give your reaction in the chat box. We'll be very happy to hear from you. And all your books, every material, the prize award will be sent to you. And today's contest also, round 2 contest also will start. So this also, it's open for everyone. So first question is over. This is a mnemonic. This is not second question. This is a mnemonic. Confluence of sinus. So this question is from your, where the cavernous sinus, venous sinuses are there, cranial venous sinuses, that chapter. Confluence of sinus. Confluence means mixture, a junction where so many sinuses meet. So this is a Viva question or even a 3 marks question. So confluence of sinus, 4 sinuses will meet. And the mnemonic is TOSS, T-O-S-S. The T for transverse sinus, occipital sinus, superior sagittal sinus, and straight sinus. So I hope it's very clear. It's there in your books, textbooks, whichever books you are following, but this mnemonic is not there. With this mnemonic, you can easily reproduce this answer. So done. Next question of the day, Waldeyer's lymphatic ring. Again, the short answer. Waldeyer's is the name of a person. Lymphatic ring. Lymphatic means lymph nodes, the drainage system, and there is a ring. So that is what we are going to study. Now this will be a diagram which is common in your books. Now when you see this diagram very carefully, there is one inner circle and there is one outer circle. Inner ring, outer ring. Right? So inner ring is the Waldeyer's inner ring. Outer circle or outer ring is the Waldeyer's outer ring. That's it. So both the rings you can write in the exam. Okay. Now see this. Just imagine this is a watch. What you're seeing on your screen, this is a watch. So at 12 o'clock position, pharyngeal tonsil is there. At 12 o'clock position, pharyngeal tonsil. So very clear, 12 o'clock. Opposite to that, 6 o'clock position, lingual tonsil. 12 o'clock pharyngeal tonsil, 6 o'clock lingual tonsil. And at what you call it, 5 o'clock and at 7 o'clock position, there is a pair. That is called palatine tonsil. Both sides it is present. Palatine tonsil or tonsil. In mouth and pharynx chapter, tonsil comes as a main question. So this is the palatine tonsil which is bilateral. And then just at 3 o'clock position and 9 o'clock position, you have got tubal tonsil. So basically, these positions you should be knowing. You cannot write wrong answer at a wrong location. You cannot do that. So 12 o'clock pharyngeal tonsil. Then at 3 o'clock and 9 o'clock position, tubal tonsil. 5 o'clock and 7 o'clock position, palatine tonsil. And at 6 o'clock, lingual tonsil. Very simple to remember. Same thing what I explained. So where is this Waldeyer's lymphatic ring? It is behind your oral cavity. It is in the pharynx. Behind the nose is called nasopharynx. Behind the mouth is called oropharynx. Behind the larynx is called laryngopharynx. So this Waldeyer's lymphatic ring is behind your mouth. That is oropharyngeal isthmus. At that location it is. So there is left side and right side. All this is the ring. The most important aggregations are left and right palatine tonsil, which is at 5 o'clock and 7 o'clock position. And this palatine tonsil is also known as tonsil. Another name is tonsils. And we read this tonsil as a main question. Then posteriorly and above, that is 12 o'clock position, we have got pharyngeal tonsil. Laterally and above, we have got tubal tonsil, that is at your 3 o'clock and 9 o'clock position. 6 o'clock position, you have got lingual tonsil. So it's very simple to remember. Along with this, you should learn the outer ring also. Outer ring. We have got retropharyngeal nodes, jugulo-digastric nodes, jugular chain of nodes, submental, lingual. All this outer ring also you should be knowing it. Don't write just inner ring and come. You should write outer ring also. This is your Waldeyer's lymphatic ring. So this is the diagram. What is there? You can learn this pharyngeal tonsil, lingual tonsil. Same thing. What I explained. So this is a ring. This ring, how it looks in a human body. So this is what the location is. It just forms like a ring here. The left diagram, what you can see. This is how it appears in the body. Okay, my dear friends, the contest begins. This is your first question for the day. Identify the components of Waldeyer's ring. 1, 2, 3, 4. Please see the location, okay? 1, 2, 3, 4. It is not in order. 1, 2, 3, 4. And your 4 options are here. The correct answer, this is the number what is flashed on your screen. Please send WhatsApp. Please send in the WhatsApp number your answers. You can send all the answers together. Right? 1, 2, 3, 4, 5 questions I will be asking all the answers together. Or you send the first question also. No problem for that. So these are your options. I'm not going to read the options. That is your work. You need to do it. I hope you are with me. So we have discussed 2 questions. Right? Waldeyer's lymphatic ring we have discussed, and the first question of the day also. I hope you are very clear with it. Okay. Now a mnemonic. This is a filler particle, which is for you. Infraorbital fissure. This is osteology question, okay? What are the structure passing through inferior orbital fissure? So many structures pass. What are the most important ones? So just remember this mnemonic zyme. Z-I-M-E. Zyme. That's it. See all these mnemonics. First of all, you remember there will be no meaning for this mnemonics. Some mnemonics may look very funny. It's okay. If it is funny, it's good. You will recollect it very fast. Right? You should not make mnemonics for each and everything. Then to remember this mnemonics, you have to do one more degree. Mnemonics should be only for the most difficult ones and not for everything. So, inferior orbital fissure, the structure passing through zyme, Z stands for zygomatic nerve, I for infraorbital vessels, M for maxillary nerve, and E for emissary veins. So it's very simple. Infraorbital fissure. This diagram you can draw. It's there in your books also. Read more. More nerves are there, but this is the most important. At least 4 you can remember very easily. Okay, so coming to the third short answer of the day. Structure between pharyngeal muscles. So these pharyngeal muscles are superior constrictor, middle constrictor, inferior constrictor. So this question is picked from mouth and pharynx chapter. And what are the structure related to them? So that is what we are going to study. Okay. So before I go into the text, please learn this diagram. Take a screenshot. This diagram will solve everything. Now, you see here, 3 muscles will be parallel to each other. These are the muscles at the back of your neck. Right here, it will be somewhere here, back. So you have got, this is your superior constrictor muscle. This is your middle constrictor muscle. And the down one is your inferior constrictor muscle. So superior, middle, and inferior constrictor muscles are there. So first you should know how to locate them. So what you can do, this diagram, you can take your pen in your textbooks. When you draw it, just shade it out because so many brown things are there, you will get confused. So just write it up or make some color. So this superior constrictor, middle constrictor, inferior constrictors are separated. So it is easily identifiable. Okay. Now this is the midline of the body, the green line what you are seeing, it is the, from here it comes and back side. So left side, right side you have. Above this here, on the top, your skull will be there. This is the skull. It's like a globe, right? So in geography, you have studied globe and atlas, correct? Globe and atlas. So this is a globe, and the first vertebrae is atlas. Now that confusion also over. So first one is atlas, second one becomes axis, right? So one more extra tip I give you: globe. So this is your globe. And globe and atlas comes in geography. So atlas is the first vertebrae. So this globe is sitting on or supported by atlas vertebrae. So here your, at this part, your skull will be there. So now this is superior constrictor muscle. The question is, what are the structure passing here? So above this. And then between, above this, 3 structures are passing. Then between middle constrictor and, between superior constrictor and middle constrictor, what are the structures here? So one muscle is there, one yellow color nerve is there. Then between the middle constrictor and inferior constrictor, what are the structure passing? You see here one artery, you can see here, one nerve you can see here. And what are the structure passing below the inferior constrictor muscle? It's a very important short answer. So there is a mnemonic for this. Again, I tell you, mnemonics have no meaning, right? It is just made blindly for us to remember. So this is your mnemonic. Just a mnemonic. A-L-A, Allah, Allah of the nose you have, right? So Allah, Guwahati station is really irritating. You can write anything. Gangtok, G for anything you can write. Okay, there is no, this is just easy to remember. Very popular station I just wrote. Just for mnemonic purpose, not for any other thing. So It's very easy to remember. Allah, Guwahati station is really irritating. Now, let us start now. So, ALA, Allah is there, right? Put a strike mark. Allah of the nose, you can remember like that. Allah of the nose. After ALA, put a strike. Guwahati station is one word. After station, put one more strike. IS is one word. So I is one and S is one. Put one bar here. Really irritating is the last component. So ALA, one bar. Guwahati station, bar. Is bar. Really irritating. I hope I'm clear what I'm telling. Okay. So now what are the structures above superior constrictor muscle? So this first three letters, what you're seeing here, ALA. This diagram is there. You can only tell now. I don't have to say anything. A, auditory tube. L, levator veli palatine. A, ascending pharyngeal artery. So this three structures, 1, 2, 3 structures. This is there the diagram. ALA are the structure which is above the superior constrictor muscle and below the skull. And that area is called sinus of Morgagni. That is a very important 3-mark question or short answer, 2 marks, 3 marks, whichever marks you are. So I hope I'm done. You understood this. Then the structure between superior constrictor muscle of the pharynx and the middle constrictor. What are this? Guwahati station. These 2 words I told you, right? So GS. G for glossopharyngeal nerve, S for stylopharyngeus muscle. GS. Glossopharyngeal, stylopharyngeus. Very easy. Then between the middle constrictor and inferior constrictor, IS. Internal laryngeal nerve, superior laryngeal artery. Very simple. And then what are the structure below the inferior constrictor muscle? Last 2 words, really irritating. R for recurrent laryngeal nerve, I for inferior laryngeal artery. It's easy, right? So now you need to learn it. It's not that once, twice you read, you will get it. 4, 5 times you need to learn it. Then you have to draw the diagram. Practice with this mnemonic. It becomes very, very easy. So same thing I'm going to explain now. So the large gap between the superior constrictor muscle and the base of the skull is called sinus of Morgagni. It's a very important short answer. So in that sinus of Morgagni, there will be pharyngobasilar fascia. In your books, diagrams, it will be in green in color. And the structure passing is ALA. Auditory tube, levator veli palatine, ascending pharyngeal artery. I have explained that. This diagram, you should print it in your brain. Then the structure passing between the superior and middle constrictor, glossopharyngeal nerve, stylopharyngeus muscle. Between middle constrictor and inferior constrictor muscle, internal laryngeal nerve, superior laryngeal vessel, IS. And below inferior constrictor muscle, really irritating. That is recurrent laryngeal nerve, inferior laryngeal vessels. So I hope this difficult portion in mouth and pharynx chapter is solved. Right. So this is again an extra. That question is over now. So now cervical plexus, arrangement of important nerve. This is like a mnemonic for you. A special filler. Okay. This is not related. The topic is over. Cervical plexus, arrangement of important nerves. So this cervical plexus, this comes from the chapter of your anterior triangles of neck. In the carotid triangle, you have this cervical plexus, right? So there you have to learn this. So the mnemonic is GLAST, blast. This is the arrangement of the cervical plexus. Greater auricular nerve, lesser occipital nerve, accessory nerve, supraclavicular nerve, and transverse cervical nerve. GLAST. If you learn this, done. Okay. Next question of the day. Nerve supply to parotid gland. Again, a very, very important question. It's a main question. See, in this question, main question, introduction, features, 4 borders, 3, all those things, you know that, right? Sorry, 3 borders, four sides are there, right? All those things, blood supply, everything you have to write. Nerve supply is the one which becomes little tricky in nature. So that is what I am trying to focus. My main agenda of this session is to help you at difficult spots, not to take one simple topic and discuss all the topic. There is no use of that. You're just few days away from exam. So what is required, all the doubt areas I am going to touch. So nerve supply to parotid gland. So my dear students, please pay a lot of attention. What I am going to talk now, you should remember for rest of your life. Same concept in second year pharmacology. Also, you have to learn this. So what you are learning today is for rest of your life. Okay. So we are going to study the nerve supply. So here we will get two terms: sympathetic system, parasympathetic system. Tell me honestly, put it in the chat box. How many of you really know what is sympathetic system and what is parasympathetic system? Yes, no, that's it. So you should be very honest. Okay, I'm just there with you like a friend. And in any relationship, honesty is very important. You tell me honestly, I will help you honestly. Right? So, do you know or don't know? Put it in chat box. I'm seeing it down, it's coming. Right. So, sympathetic system, parasympathetic system. So, my dear first year media students, open your ears and hear it very clearly. Whenever I am talking about the term sympathetic system, just imagine 3 or 4 dogs running behind a person. You can see a photograph on your screen. Just think like that. Now, what will happen? You are walking in a morning walk and suddenly 4 dogs have attacked and they are running behind you at a very, very high speed. How will you feel? Tell me honestly, you are at some 300 meters or 500 meters away, but you can see them straight road. 4 dogs are just barking and they are approaching you. How will you feel? You will feel happy. Oh, come, come, come. Will you feel like that? Definitely not. So at that moment, what will be happening in your body or your mental status will be, you will be tensed. Your heart rate will increase. You will start running. Your blood pressure will increase. Right? Sweating will come. You may start vomiting. Anxiousness will be there. You will just become panic and become completely numb. Right? Even this happens when you go for a Viva. If a surprise Viva is there, you become numb. Heartbeat increases. So by seeing this person, if 4 dogs are running behind one single person, you feel sympathy, right? You will say, "Are yaar, bichara," or power, you can call it, whatever you call it, whichever language you call it. In Hindi, it is called bichara. So you feel sympathy for this. So whenever I say sympathetic system, remember 4 dogs running behind a person, and the features of sympathetic system are blood pressure increase, heartbeat increases, tachycardia, sweating, right? So all the secretions of the body will increase, tension, anxiety, right? Vomiting sensation, and that is called sympathetic system has got activated. These are the features. Similarly, when I talk about parasympathetic system, just imagine a person lying on the bed, doing nothing, eating grapes. This is what you do when you go home, right? On the very first day of your holidays, when you go home, you just lie in front of the TV in a sofa. Same scenario. So parasympathetic system. What will happen to this person in parasympathetic system? Definitely, when you see that person, he is relaxed. Blood pressure under normal. Because he is eating grapes, so salivary secretions will be more. Right? And he is swallowing. So deglutition will be there. Physiology I'm talking, I'm correcting with physiology. Deglutition will be there. And then once it goes inside the body, there will be gastrointestinal hormones will get activated. All these hormones will get activated. And then there will be digestion, absorption, defecation, urination. So all the organs which are related with whatever I told now will get activated if parasympathetic system is activated, or when I say parasympathetic system, that means the patient is calm, relaxed, cool, right? Defecation, urination, digestion, salivary secretion, GIT hormones, and even the sexual activity. So this are all comes under parasympathetic system. So sympathetic system, very fearful phase. Parasympathetic system, very relaxed phase. So I hope you have understood this concept clearly. If not, see this again and again. So let's start. So in the nerve supply of parotid gland, you will see that parasympathetic system gets activated. Sympathetic also, parasympathetic also. But parasympathetic plays a major role here. Because secretion, parotid gland, what is the function of parotid gland? To make saliva. Parotid, submandibular, sublingual, 3 glands are the major salivary glands. Majority of saliva is made from submandibular gland, 70%, 15 to 20% is from parotid, but still it is a major contributor. So parasympathetic system, secretomotor, secretion is there, secretions, right? Parotid gland will make saliva if it gets stimulated. So it is secretions are there, and it is motor in nature. Sensory and motor nerves, 2 nerves will be there. Sensory carry information towards the brain, and motor carry information from the brain to the organ. This I have explained in the last class also. You can remember with the capital letters, 4 letters, S-A-M-E, same. S-A-M-E, that is same. Sensory, S for sensory, are afferent, A. Motor, M is efferent, E. S-A-M-E. Okay. So parasympathetic nerves, secretomotor. So it starts whenever you're eating something. So stimulus goes, sensory input goes to the brain. Oh, he's eating a mango. So the saliva comes from your mouth. So in your brain, what happens? Inferior salivatory nucleus gets activated. And then it is a relay race. Inferior salivatory nucleus will not come to your parotid gland and tell make saliva. No. Inferior salivatory nucleus will tell the next person. Like you see in Olympics or any race, it's always relay means 4 people. 1 person will run, give the baton to second person, second will run, give to third, and third will give, or he will cross the boundary line or the finish line. Same way, it starts from inferior salivatory nucleus, then the information is passed to glossopharyngeal nerve, the tympanic branch of it, then tympanic plexus it goes, lesser petrosal nerve, otic ganglion. One ganglion has come. Ganglion is like a bus station. Vehicles will travel from different cities, it will enter a bus station. And in bus station, it will relax for some time. This ganglion means a big junction. And then, before reaching the ganglion, it is called as preganglionic fibers because it is before reaching the ganglion. After the ganglion, it is called postganglionic fibers. So, after the ganglion, it is postganglionic, auriculotemporal nerve, and parotid gland. This is how it comes. So, how to remember this? Just remember this mnemonic. Indira Gandhi told Tarzan, love only apples. I repeat, this is just a mnemonic. It has no meaning. You can put any of your friends' name here in between. The main concept is to remember this pathway. I, inferior salivatory nucleus. G, glossopharyngeal nerve. Told Tarzan, tympanic branch, tympanic plexus. Love only apples. Love, lesser petrosal nerve. Only otic ganglion. Apples, auriculotemporal nerve. So through auriculotemporal nerve, it will get inserted into the parotid gland. So see the textbook, see the diagram. Auriculotemporal nerve is the nerve which is entering into the parotid gland. Now the concept will be very clear. So we have got the description. Parasympathetic nerves are secretomotor, which I already told you. Preganglionic fibers, post-ganglionic fibers. We have preganglionic fibers from inferior salivatory nucleus, glossopharyngeal, tympanic branch, tympanic plexus, lesser petrosal, up to otic ganglion is preganglion. After that, it becomes postganglion. And to auriculotemporal nerve, it reaches the gland. Very simple. That was parasympathetic, dealing with secretions. Now, sympathetic nerve, sympathetic system means tension, blood pressure, tachycardia. So, sympathetic nerves are vasomotor. So, that means this nerve is in near to a blood vessel. You can imagine like that. I am just giving you the free corrections, like just to remember things. That's it. Sympathetic system means blood pressure increases. Blood flows in arteries. So blood pressure. So some artery should be there. Just a link to connect it. So sympathetic nerves are vasomotor. Vaso means vascular supply, blood supply. Blood is in artery. So they are derived from plexus around external carotid artery. So sympathetic nerves are arise in and around the plexus around external carotid artery. Then the sensory nerves come from the auriculotemporal nerve. Auriculotemporal nerve, a branch of mandibular diffusion. So that is all about your nerve supply of parotid gland. Now, my dear friends, the winner of the first session, I am going to announce it. So, are you all excited? I am extremely excited, right? And it's my privilege and my honor on behalf of entire team of Eden 2 to announce the very first person, this quiz was conducted on 1st of October, I guess. So the winner of the session is Harsha M from Annur Dental College. Congratulations, Harsha M. It's a proud moment. You have really done it. There were more than 1,500 students who have seen that classes, and more than some 700 people to 800 people have answered. But you got all correct at a very fast rate. And there were again many people, so a lot was taken, and you are the lucky person. So Harsha M from Annur Dental College, Muachipura, you will be getting the complimentary books from our side, that is Eden 2 notes, very shortly. So please contact our customer care number. Okay, so let's proceed now. So first question of today's session, first question is over. 4 questions are remaining. So guys, you can be next. You can have an opportunity to win the next round of books. Okay, now very important question. Pterygopalatine ganglion or sphenopalatine ganglion. So it's literally a tough question for a student to answer. Before I go into this question, just see the photograph what I kept below that. What do you see there? An electric pole and lot of wires, I mean from different directions. Different directions, wires are coming. Now similarly, now in your home, the room where you're sitting, there is a bulb or there's a tube light which is brightening or which is on. So this electricity comes from where? It comes from electricity is generated in thermal plants. So you mean to say that directly from the thermal plant, your house is connected? Definitely not. So this electricity from the thermal plant will come to your city in big cables, and there will be a huge transformer, huge transformer. Then like this, one changeover will take place. From that transformer in that city, different areas, lines will go. And it will come to the second sub-transformer of that area. Then electricity has reached the second sub-transformer. From there, it will go to street-wise, area-wise. Lane 1, lane 2, lane 3. The third sub-transformer, it will go. And then 5 houses are supplied by one transformer, mini transformers. You will see that. That is the 4th or 5th or 6th sub-transformer. So how this electricity is going from one transformer to another transformer, and lot of connections are coming in one transformer, what you see outside. Similarly, ganglion. Ganglion connections are coming from different places. Just imagine whenever you hear a word ganglion, just think of an electric pole. The thousands of wires are coming, which is coming from which direction, you don't know. Remember that. And from one sub-transformer in your area, it will be one sub-transformer will be there. From there, 4 or 5 houses are supplied, or 10 houses are supplied. Right? So similarly, we are going to read that. So with this basic concept, what I discussed, let's go further. So it's a short essay, okay? This is 5 marks question, very important. So Pterygopalatine ganglion, the other name is called Spinopalatine ganglion. So Pterygopalatine ganglion is the largest parasympathetic. What do you mean by parasympathetic? A person lying in the bed eating grapes. Secretions, happy mood, relaxed. Basically secretions. So it is a ganglion which will innervate those glands which give secretions. Imagine. Understood now? This is that ganglion through which the electricity will go to those houses which give secretions. I'm mixing both anatomy and the common colloquial terms, everything for you to understand. So this ganglion or the transformer is a relay station for secretomotor fiber. That means these 5 houses will be supplied by this transformer or ganglion. Which are those 5 houses? Lacrimal gland is house number 1. Glands of the nose, 2nd. Paranasal sinus, 3rd. Palate, 4th. And pharynx, 5th. There will be some mucus secretions also inside this gland. So these 5 houses or the 5 areas or structures are supplied by Pterygopalatine ganglion or Spinopalatine ganglion. So it's very clear now. This is the largest parasympathetic, so secretions. 5 houses, electricity is going. Now, topographically, it is related to maxillary nerve, but functionally to connected to facial nerve. What does it mean? Now, topographically, what do you mean by word topographically? This word you should understand. Now, my dear friends, my name, I am Dr. Balakrishna. Basically, I am from Hyderabad. So, Hyderabad in Telangana, before it was Andhra Pradesh. But I am working in Kerala. Okay? So, my origin, and basically I am from Telangana or Hyderabad, but working in Kerala. So, that is the situation. Similarly here, topography means location. Topography means location. So based on topography, I am in Kerala. But actually, I am from Hyderabad. So topographically, it is related to maxillary nerve. So this ganglion, when you see the diagram, it will be very near to maxillary nerve. It is only near. But functionally, the major function will be through facial nerve, 7th cranial nerve. Through its greater petrosal branch. The greater petrosal branch is a branch from the first part of facial nerve. So, this ganglion, topographically, it will be near maxillary nerve. Maxillary nerve is the second V2 branch of trigeminal nerve, but actually, functionally, it is 7th cranial nerve through greater petrosal branch. So, I hope you remember this. Or, if you want to make it more easy, just write next to in your book, TM, T, topographically, maxillary nerve, capital letters M, TM divided by FF, functionally facial nerve. So TM divided by FF, topographically maxillary nerve, functionally facial nerve. Or FG also you can write, greater petrosal branch you can write. So it's very easy now. So this ganglion is a small ganglion, a flattened ganglion below the maxillary nerve. That is why we are telling it is topographically related to maxillary nerve. Right. And this gland has got some connection. So let us see the diagram first, then it will understand. See this. This is one ganglion, like one chapati. Right? One paratha type it is. flattened ganglion. Above that, maxillary nerve, topographically maxillary nerve. But who is entering? Nerve of pterygoid canal, sympathetic roots, right? So facial nerve will be entering here. Facial nerve will be entering here. So similarly, this ganglion will have preganglionic fibers, and what comes outside is postganglionic fibers. So first one, connections, motor or parasympathetic root. Motor root or parasympathetic. Again, parasympathetic means secretions. Secretomotor we call it. So that is formed by nerve of pterygoid canal. That is there in the diagram. Similarly, preganglionic fibers will start from superior salivatory nucleus, lacrimative nucleus. See, this thing, what preganglionic fibers, this is nothing but the intracranial course. If you see the diagram of facial nerve, which I'm going to discuss today, after a few minutes, I will be discussing facial nerve, same cut, copy, paste is this. The preganglionic fibers will arise from superior salivatory and lacrimative nucleus, pass through nervous intermediates, facial nerve, geniculate ganglion, greater petrosal nerve, nerve of pterygoid canal. Just compare and see the facial nerve diagram. Then this part is done. Then this fibers relay in the ganglion. They will go, stay there, and then they will proceed further. Then the postganglionic fibers supply secretomotor nerves to the 5 houses. Those 5 houses are lacrimal gland, mucous glands of nose, paranasal sinuses, palate, and nasopharynx. So that is how this motor or parasympathetic root will supply. So please learn this diagram. It's very simple. Similarly, sympathetic root is derived from the nerve of pterygoid canal, and internal carotid plexus is the one which will give it sympathetic system activation. Right. So this fibers passes through the ganglion without relay. Without relay means bus will come to the bus stand and it will just pass out. It will stay for 5-10 seconds. It will not stop for breakfast and all. It will come, stop, let the passengers get down, come in, start. That is without relay. Nerve will come and just pass through the ganglion. Whereas parasympathetic root will stay there. Here it will just pass. Just remember like that. So the sensory root comes from the maxillary nerve and fibers through the ganglion goes without relay. So what are the branches? We have already discussed 5 houses it supplies. Orbital branch, palatal branch, nasal branch, pharyngeal branch, lacrimal branch. So these are the 5 houses where it supplies. So these things you can read little more in depth. I just gave you an idea how to read. Similarly, you can read otic ganglion, submandibular ganglion, ciliary ganglion, and all are almost similar way explanations, right? So it will be very easy if you take one ganglion and read it. So see this video again and again, you get the concept, and then read the other ganglion. It's very, very easy. Okay, so that is the end of that question. Now this is a mnemonic. Internal jugular vein tributaries. What are the tributaries of internal jugular vein? So there's a mnemonic. Medical students like cheating in physiology internals. Just a mnemonic, there is no meaning for it. Medical students like cheating in physiology internals. So medical students like cheating in physiology internals. So this you can learn. So dear students, who am I? I just want to brief you. I am Dr. Balakrishna representing EDEN2, and these are our past students who have succeeded with glorious marks in their exams. Some got distinctions also. These are the list of our first batch of students, right? Way back. And in our app, EDEN2 app, we have got recorded lectures, live classes, notes, exercises, discussion, chapter-wise, question banks are there. And what you are seeing on your screen, like oral histology. So you have 2 development videos, how many lectures are there. So it is all at your ease. You can play it whenever you want. Even like 3 o'clock, you want to learn something, just click the button and the class is there with you. So we have this BDS courses, right? First year program already started from 3rd of October. And The actual price of this plan, where you have all the recorded classes as well as the notes, what is there in the app, right? Everything together is 4999. But because your exams are very near, so a crash batch, the value is priced at 999. This is just for your information. So the UPI ID is there and the phone number is there where you can do GPay, as well as the QR scan is there where you can scan it and you can register for it. So definitely you will get access for anatomy, physiology, other things are also there, other subjects also there. Just call our customer care support and our experts will help you out and they'll guide you how it can benefit. So if you have, even if 20 days left with you, a lot of things can be done. All the difficult chapters, what you have not studied, don't know the concepts, everything is explained in a very, very easy and simplified manner. Okay, so now proceeding further. Next question. This is the short Viva question, I can call it. So today, not only short answers, short essays, main question, I am even explaining you the Viva questions. So external jugular vein tributaries. So external jugular vein tributaries, we can remember with the word PAST, P-A-S-T. That is posterior external jugular vein, anterior jugular vein, suprascapular vein, transverse cervical vein. Very simple. If you learn this 2-3 times, you can really reproduce this. Now, dear friends, we are going into facial nerve, the branches of facial nerve. In our first edition, we discussed about the intracranial course. Now, the branches we are going to discuss about facial nerve. So, I told you one diagram you need to remember just now, a few minutes back, right? So, just let me show you the diagram first. This is the diagram. This you should remember. And it's a very simple diagram. It's just like this, nothing more. So, the facial nerve start from motor nucleus, lacrimatory nucleus, superior salivatory nucleus, and nucleus of tractus solitarius. So, they will come like this. You see here, motor nucleus is going separate. It's not dot, 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 dot is not there. So, that means it is a separate entity. Whereas this dot, dot ones, where you see the spots over there, they become one. That is nucleus tractus solitarius, lacrimatory nucleus, superior salivatory will become one. And they give branches, greater petrosal, deep petrosal, lacrimal. Then through spinopalatal ganglion, just now we discussed, through greater petrosal nerve it enters, facial nerve, spinopalatal ganglion. From here, 5 houses, spinopalatal ganglion supplies 5 houses. Lacrimal gland, only one they have shown because this is facial nerve. All other 5 names you can write here. Then from the second part, nerve of stapedius, cauda tympani, and the lingual nerve is here. And the cauda tympani and the lingual nerve will join and it will enter the tongue. And then it goes into submandibular ganglion and supplies sublingual and submandibular gland. Then when you see here, there is a ring. Ring means this is a foramen. So one question they ask is, cauda tympani nerve, at what distance from the stylomastoid foramen it takes a turn? Answer is 6 millimeter, 6 mm. So 6 mm cauda tympani nerve will take a turn. And then after stylomastoid, so all these are intracranial courses. This is stylomastoid foramen. After stylomastoid foramen, we have got 5 branches. 2 zebras bought my car. 2 temporal, zebras zygomatic, bought buccal, my marginal mandibular, car, cervical. Right? So this is what is branches. Within the facial canal, 3 branches. Greater petrosal, nerve to stapedius, cauda tympani. As it exits from the stylomastoid foramen, this side you can see here in the diagram, posterior auricular, digastric and stylohyoid. Then the terminal branches, 2 zebras bought my car, and but the mnemonic actually, and the communicating branches between cranial and spinal nerves. This is a part of a main question, dear friends. Facial nerve is the main question. You cannot ignore this. So I have discussed this whole facial nerve half in first session and the second half in the today's session. So chorda tympani nerve is again a short answer. So 6 millimeter above the stylomastoid foramen, it takes a turn and then it joins the lingual nerve and goes into the submandibular ganglion. So other things you can read and learn yourself. Next, Viva question. Closure of fontanelles. So this is an osteology question. Right, you have got bregma. All these things closes at what time? So as per the age sequence, remember the mnemonic which is flashed on your screen, PSMA. PSMA. So P is posterior fontanelle. It closes at 2 months. Posterior fontanelle closes at 2 months of age of baby. PS, sphenoidal fontanelle, 3 months. Mastoid fontanelle, 1 to 12 months. And anterior fontanelle, 1.5 years to 2 years. That is 18 to 24 months. So this is the sequence. PSMA. So this not only for your BDS, even for your NEET MDS, in future also you can remember this. Second question of the day, dear friends. Question is there on your screen, right? The branch of facial nerve that passes through the submandibular gland divides into 2 parts, travels along with the lower border of the mandible. Lower border of the mandible is the answer. What is that? Angular, submental, inferior labial, marginal mandibular. Phone number is flashed over there, so you can shoot your answers at this question, at this number. Okay, so we are exactly 1 hour right now, right? So I think a short break is required. You can just take a water break, right? It's just a water break, just for 30 seconds, and then we will restart. Okay, I hope you had a glass of water. Right. So this is the second question. Now coming to nerve supply of scalp. Nerve supply of scalp. Again, a mnemonic I am going to give you, which you will love it. So before coming to the nerve supply of the scalp, you would have this diagram you will be aware of, right? Blood supply is there, nerve supply is there. This you will be aware of. So this nerve supply, this is what we are going to focus. So what is in front of the auricle? What is behind the auricle? So there are sensory and there are motor nerves also. That is what we are going to study now. So in front of the auricle, so this is the auricle here. In front towards the nose and all this area, there is 4 sensory and 1 motor. 4 sensory, 1 motor in front of the auricle. Similarly, behind the auricle, 4 sensory, 1 motor. So the 4 sensory, remember a mnemonic ZASS, JAS. Z for zygomaticotemporal nerve, A for auricotemporal nerve, S for supraorbital nerve, and another S for supratrochlear nerve. So this 4 you can remember like ZASS. These are sensory innervations. And the motor innervation is by temporal branch of facial nerve. Temporal branch of facial nerve, 7th cranial nerve. Sensory is by 5th cranial nerve, trigeminal. You can see that all of them are branches of 5th cranial nerve. So here outside you can write 5th cranial nerve in your textbook, and motor nerve is by 7th cranial nerve, ZASS, JAS. Similarly, behind the auricle, you have got again 4 sensory, 1 motor. So the 4 sensory you can remember like GL3 into occipital nerve. GL3 into occipital nerve. Into means the multiplication. That means G, greater occipital nerve, L, lesser occipital nerve, 3, third occipital nerve, greater, lesser, third occipital nerve. And the 4th one only you have to remember is posterior division of great auricular nerve. These are sensory branches. And the motor nerve supply is by posterior auricular branch of facial nerve, again 7 cranial nerve. So the motor branches in front of the auricle, behind the auricle, both are 7 cranial nerve. In front of the auricle, sensory innervation ZASS. Behind the auricle, GL3 into occipital nerve. Just read and learn 2-3 times. You will never get confused and you will write very correctly in your exams. So dear friends, the third question of the day. The scalp is supplied by great auricular nerve in both front, nerve in front of the auricle, supplied by supratrochlear or supraorbital arteries, which are branches of facial artery. C, supplied posteriorly by great occipital nerve from the ventral ramus of C2. D, supplied behind the auricle by lesser occipital nerve. And E, drained by supratrochlear or supraorbital veins. So these are the 5 options. You can answer the correct one and you can win most exciting and very prized notes of heading 2, which will help you to get very high score in your exams. Next question, facial muscles. This is from your scalp, temple, face chapter. So dear friends, facial muscles you are reading from a very long time, but the problem is it's little difficult to recollect and remember all the names of the muscles. So this facial muscles generally we study in 4 different ways. We can study embryologically, morphologically, topographically, and functionally also. So embryologically, we can study embryology. So this facial muscles, what we have, they are from the mesoderm of the second brachial arch. So first arch, second arch, third arch is there from the mesoderm of the second brachial arch and supplied by facial nerve. Morphology means shape. So based on shape, they are the best remnants of pananiculus carnosus. It is a subcutaneous muscle sheet which is seen in pigs actually. Okay, pigs and rodents, but more in pigs and all. It resembles. It is not like that. It resembles. It morphology look like that. That's it. So embryologically, facial muscles, mesoderm of the second brachial arch. Morphologically, remnants of pananiculus carnosus, which is a muscle. So this is the diagram which is there in your books. You should know. So now around the eye, around the nose, around the mouth. So many names will be there. We will decode them very fast. And then you see here, this is a place which is here where I am pinpointing. This aggregation of 8 muscles is called modulus. Please remember this. This can be a short answer. So what are the 8 muscles? All will come and meet at a point, like a junction where so many roads will come at one point. So zygomaticus minor, zygomaticus major, levator anguli oris, rise oris, depressor anguli oris, platysma muscle, buccinator muscle, orbicularis oris muscle. Everyone will come and meet here. So this is called modulus, aggregation of 8 muscles. That is a separate thing. So let's start now. Muscles of the scalp. This we have discussed in our previous day also. There is only one muscles in the scalp, that is occipitofrontalis. So this is topographically based on location. Next, muscles of the auricle. The muscles of the auricle, just remember a mnemonic APS. Auricularis A, anterior, auricularis P, posterior, auricularis S, superior. Anterior, posterior, superior. Very simple. APS. So in your book, just write APS. You will never forget this. Muscles of the eyelid, LOC. Like India-Pakistan border, LOC means line of control. So when you go to that area, can you see that line, or you can hear that line, or you can smell that line? Definitely you can see that line. So muscles of the eye, LOC. Just remember like that. L for levator, palpebral superiorus, O for orbicularis oculi, and C for corrugator supercilii. Very simple. NOC. Muscles of the nose, DCP's daughter. In movies and all, you will see that how they are projected. A very high profile father and daughters are very arrogant and all, and they will fall in love with the hero and then they will change. All those things the typical Bollywood movies, you will be seeing that. So muscles of the nose, DCP's daughter, anger is always on the nose. There is a proverb, her anger is, or his anger is always on the nose. So DCP's daughter is just a mnemonic. D, dilator nares. C, compressor nares. P, procerus. Daughter D, depressor septi. So these are the four muscles which you can see in the diagram also. Next, muscles around the mouth. It's a beautiful mnemonic. You will love it. So there are so many muscles around the mouth. You can remember this with a big mnemonic. Ooh la la la. Zoom zoom. DD. MRB. 5 times you read, you will easily reproduce it. All the students who have studied this mnemonic under me say that, sir, this is one of the easiest and we love this. And you will be able to tell all the names of the muscles around the mouth. Ooh, la la la, 3 times, okay, la la la. You can put a slash, zoom zoom, slash, BD, slash, MRB. So slash means parts I am breaking it. So O la 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 la. O orbicularis oris. 3 times la. Levator labiae superiorus. Levator labiae superiorus. This is alquinacy. Levator anguli oris. Zoom zoom. Zygomaticus major. Zygomaticus minor. DD. Depressor anguli oris. Depressor labiae inferiorus. MRB. Mentalis risorius buccinator. Right? So this will solve everything. And muscles of the neck, this is platysma muscle. So these are the muscles of the face which you can read topographically. So dear students, so far we have discussed so many Viva questions, so many mnemonics, short answers, short essays we have done. And now I am going to the last part of the day, that is PMJ. It's a main question, right? So this will take another 10 minutes. So my request to all of you is, whenever you are seeing this classes, because it is there, it will be there in YouTube. See for 15 minutes, topic to topic, take rest, revise, go to your textbooks, read it again, learn properly, then continue the video. Learn with this video. Then only you will be able to get the most of it. Just by listening, you will not get, you have to practice, read, draw the diagrams, and follow all the instructions perfectly. Then only it will happen. Right. So next 10 minutes, the most important, the most asked question of the, what you say, anatomy, human anatomy is temporomandibular joint. That is what we are going to study. So this is the joint you see here. This is the mandible. This is called condyle. Then this is called mandibular notch or sigmoid notch. And then you got coronoid process here. And here, this is the temporal bone. That is why it is called TMJ. Temporal TM mandible joint. Temporomandibular joint. Right. So coming to the introduction, what are the other names of temporomandibular joint? See, we all have our nickname. Some will have Tinku, Chinku, Pinku, all common names will be there. Similarly, the other name for TMJ is giglino-diarthroidal joint. Giglino-diarthroidal joint, and this is a joint, synovial joint of condylar variety. Synovial is the fluid, a protein fluid, which is liquid is there here. So this is the synovial joint of condylar variety. Right. So let's begin. So first and foremost, there are articulating surface. See, it is a joint. Upper, this is temporal bone. The hand which is above is temporal bone. The hand which is below is the mandible. They both are contacting. So who is contacting? This is a rubbing surface. This palm and this palm, they are both rubbing. So this which comes in contact are called articulating surface. Articulating surface are contacting surface. So we got upper articulating surface and the lower articulating surface. Upper articulating surface is formed by temporal bone. Lower articulating surface is formed by mandible. That is how they contact. So upper articulating surface is formed by Articular eminence, you see, which is a part of temporal bone. Above everything is temporal bone. This black color line, what you are seeing, this is articular eminence. And anterior part of mandibular fossa. This is the mandibular fossa, anterior part of mandibular fossa, anterior articular eminence, upper articulating surface. Then the inferior articulating surface, which is the lower one, which is contacting the lower part, I am telling, it is formed by mandible, formed by head of the mandible. So this articulating surface, it's not bone to bone direct contact. There is a cushion over there. Cushion will be there, and that is fibrocartilage. The articulating surface are covered with fibrocartilage. So you have got contacting surface, upper articulating surface, temporal bone, lower articulating surface, mandible, and fibrocartilage is there in between both of them. So when you see this joint, you see the central part, there is a black color in this diagram, which is called an articular disc. So with the help of this articular disc, the whole joint is divided into upper compartment, lower compartment. What you are seeing above is upper compartment, and what you see below is the lower compartment. So the joint cavity is divided into upper and the lower parts by intra-articular disc. So this black color S shape is intra-articular disc. Next, coming to ligaments. So there are 4 ligaments in temporomandibular joint. These ligaments will support the joint. Otherwise, this mandible, this joint will go here and there. It has to be anchored. So 4 ligaments are there: fibrous capsule, lateral ligament, spinomandibular ligament, mandibular ligament. The name itself tells spinomandibular, from sphenoid bone to mandible. Okay, so these are the 4 ligaments which will stabilize the joint. So fibrous capsule, it will cover the entire joint. In some diagrams, it is shown as green color, full like one bed sheet covered over there. So above, it will go up to the S-shaped articular eminence, and below to the neck of mandible, it will be covered. So this fibrous capsule, when it is covered, your articular disc is there. At that area, it will be little loose. Above and below, it will be tight. Next is your spinomandibular ligament, right? So reinforce and strengthen the lateral part. The lateral ligament is that. Then spinomandibular ligament from sphenoid bone to mandible, right? So these are the ligaments. You should write the origin and insertion, and which part they are going to anchor them. So the ligament is, again, the relations of the ligament will be this diagram in your books: lateral pterygoid, auriculotemporal nerve, chordatympani nerve, wall of the pharynx. All those things you can have a read, right? Then comes the 4th ligament, right? So that is your stylomandibular ligament. So joint capsule. This is very simple. Now coming to articular disc. This is the articular disc, what you're seeing here. Articular disc is the one which divides the joint cavity into upper compartment, lower compartment. It's like a bridge, above and below it will be there. So upper compartments, only gliding movements. So you can write UG, upper compartment gliding movements, divided by lower compartment rotatory and gliding movements. So divided by GR. UG divided by, or U also you cut it, numerator, which is above, is numerator divided by denominator. You can write G divided by GR. Very simple. So once you write it in your book, G divided by GR. So above is G, so upper compartment is gliding movement, denominator is GR, so the lower compartment is gliding and rotatory movements. So this disc is concavo-convex or S-shaped, and it has got 5 structures. You can see here: anterior band, intermediate, posterior band, and then bilaminar zone will be there. This you can read in your books. This is one: anterior extension, posterior extension, anterior band, posterior band, intermediate band. 5 divisions or 5 parts of articular disc. Blood supply of TMJs: superficial temporal and maxillary arteries, which are branches of external carotid artery. I have discussed in my first session. Veins follow the arteries, and nerve supply is by auriculotemporal nerve, which is the branch of mandibular nerve, and mesenteric nerves. This is the diagram which you can draw that. This is a very common question, right? I know you would have learned this. Just a quick revision I am doing so that you don't miss it out. Now, the movements are very important. Protraction, retraction, opening the mouth, closing the mouth. Before I go into this, please listen to me very carefully. You will get two muscles, medial pterygoid, lateral pterygoid. Whenever I am telling in the word medial pterygoid, whenever I am saying me, my mouth is closing, my tongue is coming together with the hard palate. Me. And whenever I am telling lay, my mouth is opening. So medial pterygoid is for closing the mouth. Lateral pterygoid lay, my mouth is opening. So it is for opening the mouth. Medial pterygoid is for closing the mouth. Lateral pterygoid is for opening the mouth. So the movements, articular disc above is temporal bone, below is mandible. So it is called, upper part is called meniscotemporal movements or compartment, and the lower ones are called meniscomandibular. Because mandible is below, upper is temporal bone. Meniscotemporal, meniscomandibular movements. Forward movement is called protraction. Backward movement is called retraction. And chewing movement, side to side movements, we have got protraction. Forward along with the disc has protraction, and the head of the left side rotates on the vertical axis. Right. So these are the few things which you have to read again and again. I will be focusing on muscles which produces this movement. So some mnemonics I will be telling you, please write it down. Now, whenever see your maxilla is fixed, only your mandible moves. You can open the mouth means mandible is moving down, maxilla is fixed. If you are closing the mouth means mandible you are closing. Okay, so mandible is the movable bone, the maxilla is a fixed bone. So depression, so the mandible is going down or opening the mouth. This is brought about by four muscles, and the four muscles are D, G, M, L. D, digastric, G, gynoid, M, mylohyoid, and lateral pterygoid. Lateral pterygoid, lay, opening the mouth. So opening the mouth means the mandible is going down, depression of the mandible. I hope it's very clear now. So depression, DGML. Then elevation. Elevation, MTM. Masseter, temporalis, medial pterygoid muscle. Elevation, closing the mouth. Me, my mouth is closing. So elevation is by MTM. That is masseter, temporalis, medial pterygoid. Protrusion is by lateral and medial pterygoid. Retraction is by posterior fibers of temporalis, and lateral side to side movements is produced by right lateral pterygoid and right medial pterygoid, and vice versa. Right? So the basic elevation, depression, protrusion, retraction you should know. That will help a lot in reproducing the answer correctly. And please understand also. Do not just mug up the answers. So coming to the clinical anatomy, dislocation of the mandible. So when some people you see that when they open, the articular disc go forward and the mouth is open only. They cannot close, especially in old age people or the denture patients. When you say open, open, open mouth, and tuck, one sound will come and the mouth is open. They cannot close their mouth. So that is called dislocation of the mandible. So for this patient, what you should do, this patients, you should make them sit upright in a dental chair or like towards head leaning towards a wall. Wear gloves, take some gauge piece, put behind the distal most tooth, the third molar will be there. With the thumb, keep inside the mouth, you are wearing gloves inside. Then tell the patient, I will tell 1, 2, 3. And whenever I say 3, try to close the mouth. So that you have to communicate to the patient. So when you are doing 1, you will depress the mandible. 2, you will push the mandible backward. And 3, you will push the mandible upward. For patient, it is 1, 2, 3. But you, 1 means depression, 2 means backward, 3 means upward. So when you say 3, you are putting upward motion, and patient is also trying to close correctly. The articular disc will go back and it sits in its correct position. This is explained in the books. Go back and read this. Then there could be dearrangement of articular disc. Elasticity may go. So you have to give steroid injections or strengthening the articular disc. Lot of that is all you will study in final years. And whenever you are doing any TMJ surgeries, facial nerve passes through here and 5 branches. You have to be very careful regarding that. So this was an overall. I explained you the temporomandibular joint. It's a main question. So introduction. Your ligaments you have to explain. The relations you have to explain. Blood supply, nerve supply, clinical anatomy, and the movements of TMJ. So this is the question what you should be knowing. So dear friends, we are coming towards the end of our session now. The fourth question of the day: muscle responsible for lateral movement of the mandible. Lateral, medial and lateral pterygoid, masseter and lateral pterygoid, masseter and medial pterygoid, or masseter muscle. So it's very simple now. Number is there, you can write that. This is the fourth question of the day. And the fifth question of the day, the last question. The temporomandibular joint has all the following features except superior compartment, articular disc, medial compartment, synovial fluid. The name is there. This one word I have not used anywhere, so that is the answer. I'm just giving you clues. So this is your fifth question. So all the students who are there with me, who have heard these 5 questions, please write, and you post these answers. You will be eligible for the last scrutiny, and if your answers are correct, you are fast, you can get into books. So dear students, once again I repeat, these are our alumni students. Edent2 app has got recorded lectures, live class, notes, exercise, everything's are there. 1-year program is there. It's for all years, first year to final year, right? So the exclusively plan is actually 4,999 rupees, but exams are coming. So crash course batch 999, where you have all the materials available at your fingertips. So this is the QR code, and this is your number where you can contact. This is our customer care support also. You can call at these numbers and you can clarify your doubts. So I guess we had a very nice session both the days, day 1 and today day 2, right? So please give your feedbacks. It's still active. Please give your feedbacks. It's very, very important, because your feedbacks gives us strength and energy and motivation to come up with more sessions like this, right? So please put your feedback right now only, so that it will be, what you say, a motivation for us also. So dear students, again, I wish you a very happy studying, have a wonderful and a positive future. So please make sure you study well. You should go completely well armed for your exams. No chapter you should miss. Everything you should do. All the question banks you should do. There should not be anything which you have not covered. Not only gross anatomy, even embryology, histology, osteology, it's neurophysiology, so much is there. Neuroanatomy, so much is there. But it's been a year, still you are 20-25 days, or how many days, you only know better, away from your exams. So value each day, give your best each day, go with a positive mindset. The positivity will really work for you. Right? So once the battle is won here, what is inside you that matters. Do you know, dear students, we have mineral water bottles. Outside we get bottles, right? 10 rupees, 15 rupees, bottles are there. So when the bottle is with water, the cost of the bottle is 15 rupees. Mineral water, I am telling you. And when you empty the water, what is the cost of that bottle? Nothing. 0 rupees. So it is what is inside that matters. That is the water in the bottle. Similarly, in our life, what is the knowledge we have inside us? That matters. I do understand this is an exam time. You have to be very quick. Knowledge and all, for that the time is 1 year was there. Now this is the time to make sure all the untouched areas we need to cover up and finish it up. So have a nice timetable. Any doubts, any queries, please contact our executive. They will help you. So, dear students, wishing you all the very best. Thank you. Thank you for your time. Thank you so much.